Hello, everyone. My name is Maria Kirley, and I am a Master's of Public Health candidate with concentration in health behavior health promotion here at the University of Arizona. My internship was completed at the Arizona Department of Health Services within the Bureau of Chronic Disease and Health Promotion. Today, I'll be sharing an overview of my applied practicum experience titled Alzheimer's Disease in Arizona, a Public Health Perspective on Programs, Policies, and Future Recommendations. Before starting my internship, I set a few personal goals, which were strengthening my applied public health skills, learning how policy is implemented at the state level, and improving professional communication and collaboration. I also really wanted to aim on observing real world policymaking through participation in different things like I served on the Alzheimer's subcommittee of the Governor's Advisory Council on Aging. So, like I shared, my internship site was at the Arizona Department of Health Services within the Bureau of Chronic Disease and Health Promotion. The Bureau's mission is to promote, protect, and improve the health and wellness of Arizonans. And the Bureau operates within ADHS and manages several state level programs ranging from Alzheimer's disease and dementia related diseases, cancer prevention, diabetes, and even heart disease prevention. My main responsibilities included conducting a literature review and developing and distributing a qualtrics survey as part of an environmental scan. And my final deliverable was kind of creating a findings and recommendations report. I also met with my preceptor, Teresa, many goats weekly, where we worked together and she helped provide feedback, discuss any challenges, and address any next steps when it came to my deliverables. My tasks were self-directed with guidance from my preceptor and my faculty chair. I also had the opportunity to collaborate with several ADHS staff members within the Bureau, a few professional engagement initiatives I shared a little bit earlier, but I attended the Governor's Advisory Council on Aging, Alzheimer's disease and related disorders subcommittee. Within the subcommittee, I was able to observe statewide discussions on policy, data collection measures, and recommendations related to Alzheimer's programs. I would say a big purpose of this was to help strengthen my understanding of how state agencies coordinate policy development and different stakeholder collaboration in public health practice. Okay, my objectives were to conduct a comprehensive literature review on Alzheimer's and dementia-related diseases, focusing on public health interventions, caregiver support, and policy frameworks. I also performed an environmental scan to identify existing Alzheimer's programs, policies, funding sources, and different gaps at the state and national level. And then my final deliverable was to develop a findings and recommendations report that helped synthesize the results of my literature review and my environmental scan. This slide maps my deliverables to the MPH competencies I demonstrated during my internship. For the literature review, I reviewed proposed strategies to identify stakeholders and build coalitions, evaluated evidence for effective health promotion programs, and assess policies for their impact on health equity, aligning closely with the policy and evidence-based practice domains. For the findings and recommendations report, I focused on assessing population needs and applying cultural awareness in program and policy design, demonstrating the planning, management, and leadership competencies listed here. I would say together, these deliverables really helped show how I met both the foundational MPH requirements and also the health behavior health promotion concentration skills through applied evidence-based practices within the Arizona Department of Health Services. So, like I shared a little bit, my project resulted kind of in we had two agency-based deliverables, but two agency-based deliverables with kind of like the third component activity. The first being a comprehensive literature review summarizing Alzheimer's policies and best practices. The second was a findings and recommendations report, integrating both sources to guide future ADHS planning. This consisted of developing a brief qualtrics survey or environmental scan, which helped collect different perspectives from individuals living with ADRD, their caregivers, and community organizations or representatives. So, for the comprehensive literature review, the purpose was to identify existing Alzheimer's disease and related dementias, programs, policies, and best practices to inform Arizona's state level public health strategy. So this consisted of me reviewing peer-reviewed literature from sources like PubMed, CDC, WHO, and my local Arizona Alzheimer's Association chapter. My search terms focused a lot on different keywords like Alzheimer's public health, caregiver support, and dementia-friendly communities, different state Alzheimer's plans. We can kind of see what that looked like. It's really important to focus on materials published within the past 10 years so we could get a really overview of ADRD at the state and local level while also keeping the research relevant and recent. I also spent time screening studies and reports for prevalence to prevention policy or community-based support. Data extraction and synthesis consisted of organizing key findings related to Arizona's policy coordination, caregiver support, health equity, and early detection. I also utilized this literature review to help summarize outcomes and identify any gaps relevant to Arizona's context when it came to Alzheimer's and dementia-related diseases. These findings will be later integrated with the survey data from the environmental scan in that final recommendations report. So, to complete the literature review, I created a brief Qualtrics survey. Our target audiences was individuals living with ADRD, their caregivers, and different community organizations or representatives. This survey was distributed through ADHS internal and external community partner networks and is currently in the data collection phase. The analysis will include maybe some possible descriptive statistics and maybe some thematic coding, and results will be integrated in my final recommendations report. So the literature review highlighted a few key themes. There is underuse of early detection and diagnosed services, underused caregiver support, large health equity gaps, and success in states with Alzheimer's. And we have, sorry, I apologize. We've seen some large health equity gaps when it comes to like rural areas. And there was some note that there has been some brief success in states that have opted to create like an Alzheimer's task force or specific dementia friendly initiatives. I would say that these findings helped highlight a need for a strong foundation and identifying strong actionable steps that could be implemented across Arizona. So the results for environmental scan, this Qualtrics survey is still open. We intend to close this within the next week or two. But the purpose of this survey was to collect input from individuals living with Alzheimer's and dementia-related diseases, their caregivers, and certain community organizations or representatives to help identify service gaps, challenges, and opportunities. Like I shared, this Qualtrics survey was distributed through ADHS's internal and external community partner networks. Responses are currently being collected. Preliminary feedback for this survey indicates interest in improved caregiver support and better access to local resources. My next steps for this piece in my deliverable is to complete data analysis and summarize quantitative and qualitative findings. These results will be integrated with the literature review insights, and then this will be implemented into that final findings and recommendations report to illustrate key findings. I would say the expected outcome for this environmental scan is to kind of help create a data-informed summary of community perspectives across Arizona that will help guide ADHS's Alzheimer's and dementia-related diseases programming for the next few years. Okay, so let's take a minute to kind of discuss the broader public health issues related to this project. I would say that this project directly connects to public health practice. Alzheimer's and dementia-related diseases is a chronic condition tied to things like health equity, access, and aging in place and aging in a healthy manner. Throughout this applied practicum experience, I applied several theories from health behavior policy to epidemiology in these real-world settings, bringing my classroom learning with community impact in a real-world setting. So a few challenges and lessons learned. I think a few challenges was working with my preceptor to kind of decide who we were going to send this survey to. So recruiting diverse survey participants and kind of figuring out, we're still kind of working it out as the survey is still open, identifying how we would like to analyze some of our open-ended responses when it came to the survey. I think partnering with community organizations really helped address this. I think lessons learned include the value of collaboration, adaptability, and also working with each other to kind of translate this evidence into practice and like actionable next steps. I also think that community engagement is something that's a really, really important thing that I learned throughout this practicum, that community engagement definitely enhances data quality, which then can lead to policy relevance. So overall, this internship has really helped me apply my Master's of Public Health competencies in a meaningful way in a real world setting. I think from policy evaluation to program planning, a few things I learned about myself throughout this process is it's really helped strengthen my research analysis and communication skills. I think this project had some pretty heavy deliverables that I was kind of nervous about, but I was very excited. You can do the work for a project like this, but really working with my preceptor and the analysis and research that I had to help translate this evidence into, easily digestible and recommendations that made sense and also aligned with ADH's mission. Because you do an APE project and you really want to see that this work kind of stays with the organization. And so it's really important for me to have this real world collaboration between agencies, policymakers, and community so I could really see this progress even once I leave this project. So I think that this also leads into that these deliverables will really help to inform ADHS's future Alzheimer's planning, funding, and different outreach strategies. So I'm finished with my presentation now. I really want to take a moment and I hope that you all have enjoyed listening to the overview of my APE experience. And I want to say thank you to my preceptor, Teresa Manygoats, and to everyone at ADHS that spent time working with me on this project. I learned so much and I am so forever grateful for this experience. Thank you, everyone, and I hope you have a wonderful day.